Well, hello, and welcome to today's presentation entitled Therapeutic Updates, Best Practices, and Barriers to Care in the Management of Type 2 Diabetes Mellitus. My name is Ann Lynch, and I am an Associate Professor of Pharmacy Practice at the Massachusetts College of Pharmacy and Health Sciences in Worcester, Massachusetts, where one of my areas of focus is diabetes, in addition to pulmonology, rheumatology, and veterinary pharmacy. At this time, I have no disclosures to declare, and for the purposes of this presentation, I will not be discussing off-label or unapproved uses for the agents included. I'm happy and honored to be here with you for the next hour or so to talk about type 2 diabetes mellitus, including therapeutic updates, best practices, and barriers to care, hence our title. While we're discussing the management and concerns and practices of type 2 diabetes mellitus, we're going to be discussing the current trends in disease prevalence and economic burden of this encompassing disease, and our role as healthcare providers in helping to relieve some of that burden. We'll also outline the recent diagnostic criteria and definitions, as well as identify the challenges to successful disease management and possible suggestions to overcome those challenges. And throughout the presentation, we'll review treatment options, both pharmacologic and non-pharmacologic, and we'll include some safety and efficacy information and the impact of the agents on weight and hypoglycemia. We're also going to discuss a few new models or schools of thought about management of type 2 diabetes. And finally, we'll wrap up by reviewing a patient case. So with that, it surely looks like we have a lot to talk about in the next hour or so. So what do you say we get started? So let's start off with a definition of type 2 diabetes mellitus, or as I'll be referring to it as type 2 diabetes, or diabetes in this case. But diabetes mellitus, it really describes a group of metabolic disorders, which is characterized by hyperglycemia, of course, which usually is due to impaired glucose homeostasis. The main types of diabetes are type 1, which is characterized by a complete insulin deficiency, and type 2, characterized primarily by both relative insulin deficiency as well as insulin resistance. There are other many types of diabetes that exist, which would also include gestational diabetes mellitus, diabetes from endocrinopathies such as Cushing's syndrome, and drug-induced diabetes. The focus of this presentation, of course, is on type 2 diabetes. The chronic hyperglycemia of diabetes is associated with long-term damage, dysfunction, or failure of different organs, most particularly the eyes, kidneys, nerves, heart, and blood vessels. Type 1 and type 2 diabetes account for approximately over 95% of all patients with diabetes, with the type 1 accounting for about 5% of all diagnosed cases, and type 2 accounting for approximately 90 to 95% even. As many as 7 million folks are undiagnosed, and it's estimated that in 2010, 79 million American adults over 20 years of age had pre-diabetes, and we'll be talking about that shortly, about what pre-diabetes is. These estimations are what have led the recent change in focus to more of a preventative type, so prevention and early detection, and a delay of onset of diabetes. In 2010, also there were almost 2 million individuals over the age of 20 that were newly diagnosed. The prevalence of obesity and diagnosed diabetes have been evaluated in each state of the U.S., and we're going to see that in our next slide. So here's a slide that, as of 2010, you can see that the southeastern or southern Midwestern states of the United States have the highest prevalence of both obesity and diabetes, which is completely expected that folks that have the higher prevalence of obesity would logically have higher prevalence of diabetes. Mississippi and Alabama are the states that actually have the highest incidence of diabetes at over 11%. West Virginia, Tennessee, Louisiana, Kentucky, and Oklahoma have a prevalence of diabetes in over 10%. And the state that had the lowest prevalence of diabetes at 5.8% was actually Vermont. But despite the higher prevalence of diabetes in Alaskan natives, which we'll talk about in a minute, Alaska, surprisingly enough, had a lower prevalence of diabetes compared to the other states at 6.3%. Rates for type 2 diabetes rise sharply with age, as we know and expect, and it does so for both genders and for members of all racial and ethnic groups. The prevalence of diagnosed diabetes is about 7 times higher among adults aged 65 years or older as compared to those individuals between the ages of 20 and 44. Average medical